Scooby-Doo is a multivitamin product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and help maintain good health. It is important to take Scooby-Doo as directed by your healthcare provider to ensure you are getting the right amount of vitamins. It is usually taken once daily with a meal. Taking it at the same time each day will help you remember to take it. Always follow your doctor's instructions for the best results. When taking Scooby-Doo, make sure to chew it thoroughly and swallow, usually once daily or as directed. It's important to follow all directions on the product package or as directed by your doctor. Don't take more than the recommended dosage. If you have any questions, ask your doctor or pharmacist. For best results, take Scooby-Doo regularly at the same time each day. This will help you get the most benefit from the medication. Remembering to take it at the same time each day will also help you stay on track with your treatment plan. If you experience constipation, diarrhea, or upset stomach, it's usually temporary and may go away as your body adjusts to Scooby-Doo. If these effects persist or worsen, contact your doctor or pharmacist. Your doctor has determined that the benefits of Scooby-Doo outweigh the potential side effects. Many people using this medication do not have serious side effects. A serious allergic reaction to Scooby-Doo is rare, but seek medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects, contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If your multivitamin contains iron, it's crucial to keep it away from children. Accidental overdose of iron in children under 6 years old can be fatal. If an overdose does happen, seek medical help immediately or call a poison control center. Before taking Scooby-Doo, make sure to inform your doctor or pharmacist if you are allergic to any of its ingredients or if you have any other allergies. It's important to discuss your medical history, especially if you have a history of alcohol abuse, liver problems, or stomach/intestinal problems. If your multivitamin also contains folic acid, let your doctor know if you have a vitamin B12 deficiency before taking it. This medicine may also contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist. Before undergoing surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this medication. When taking Scooby-Doo, it's important to be aware of potential interactions with other medications. This could affect how your medications work and increase your risk for serious side effects. To prevent any issues, keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If your multivitamin contains iron, it's best to avoid taking Scooby-Doo at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. It's important to ask your doctor or pharmacist about how long you should wait between doses and to find a dosing schedule that works with all your medications. If your multivitamin also contains folic acid, make sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, Scooby-Doo may interfere with certain lab tests, so it's crucial to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Scooby-Doo and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call 1-800-222-1222 for your local poison control center. Canadian residents can call their provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Make sure to attend all scheduled medical and lab appointments. It's important to note that Scooby-Doo is not a replacement for a balanced diet. It's always best to get your essential vitamins and minerals from healthy foods. Be sure to maintain a well-balanced diet and follow any dietary recommendations provided by your doctor. And as always, consult with your doctor or healthcare provider before starting any new supplement regimen. If you forget to take Scooby-Doo on your prescribed schedule, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Don't take extra to make up for it. Remember to take your next dose at your regular time. Make sure to store Scooby-Doo at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to getting rid of Scooby-Doo, don't flush it down the toilet or pour it into a drain unless you're told to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.